Welcome to Real People, Real Voices. I'm James Jackson.
And I'm Pastor Wayne Moore.
Always a pleasure to host with you.
It is, my friend. It's good to be right here with you. You know, I miss you, man, when we're not together.
Yeah, there's a lot of time between the times that we do.
Yeah, but we know we manage to stay in touch with one
do.
another. That's what
That's what friends do.
That's what friends are supposed to do.
Yeah.
Yeah, that's what friends are supposed to do.
We got a great show.
Got a great show. Got a young lady here, Miss Ballard from Marion County Public Health Department. She's going to talk about the infant mortality rate and what's going on with it and what we can do to make some adjustments, if there are any to be made.
Yeah.
She's going to give us some data, some statistics about how it stands here in the state of Indiana and especially Marion County.
Yeah, it's a big deal, probably bigger than most people know.
Yes.
And I want to encourage you all to make sure that you are watching on Friday evenings and on Sunday afternoons also, if you missed this show, or you want to go back and look at some of the things that we've talked about. A lot of great information. You can do that. Please go to YouTube, WHMB TV 40, and you can watch this show when it's over, as well as others that you might miss. And
like us on Facebook. We're there waiting on you. Give us an opportunity to come into your life and share some of the information we've been sharing with the Central Indiana. Love to have you.
And we've got some great sponsors. When we come back, we're going to lead into our next guest with sharing with you our awesome sponsors. And almost all of them, not all of them, but a few of them we're interviewing over the next few weeks.
Yes, sir. We'll be doing that, and we're going to be sharing them with you when we come back.
Welcome back to Real People, Real Voices. Dr. Moore, we've got some great sponsors.
Yes, we have some sponsors here with us today. Going to share them with you today. Tamiko, an Associates Realty Group. She's doing a great job here in the city of Indianapolis and all around Central Indiana. Not only that, Martin University has been with us for some time now. Thank you, Martin University, for sponsoring Real People, Real Voices. Marion County Public Health Department. And we're happy to have a guest with us today from that particular establishment. Lee Cossell and Crawley are with us, been with us from the very beginning. Fervent Prayer Christian Academy has been with us from the very beginning. Thank you, Fervent Prayer. And Isles Modern Clothing and Shoes, His Place Eatery, and Northside Window and Gutter Cleaning. Those are our sponsors. And if you want to sponsor, please contact the station, Channel 40 WHMB TV, and we'll be right here.
The list is growing.
Yep, the list is growing, sponsorship is growing, and that's what we're here to do, to make sure we get the information out about what's going on around the town and in Central Indiana.
And speaking around town, we've got the Marion County Health Department, Indianapolis Healthy Start Community Engagement Coordinator.
Yeah.
Yes,
Welcome to the show, Ms. Ballard.
Thank you for the invite.
You're welcome. Thanks for being here.
No problem.
So before we get into infant mortality, tell us what you do, what your assignment is there, and how long you've been doing it.
Well, my name is Victoria Ballard. I am the Community Engagement Coordinator with Indianapolis Healthy Start, and what I do is I focus on developing the partnerships for the program. So just looking at community organizations who have like agendas and kind of have the same and share the same vision in regards to reducing infant mortality in Marion County.
All right, so very specific assignment, and
Yes.
Just how big a problem is infant mortality in the state of Indiana and then specifically Marion County?
Well, it's a very big problem. Indiana is one of the 15 worst states in reference to infant mortality. It's a situation that we have been fighting for years in Indianapolis. Excuse me, Indianapolis Healthy Start is actually one of the original projects. You know, there's 100 projects nationally across the states of Healthy Start projects, and through their initiation, that's what they did. You know, they focus on organizations and communities who were facing the highest infant mortality rates. So they got together, deemed, processed organizations, results, and made sure that they developed these programs to make sure they were focusing on decreasing those infant mortality rates.
We're having a problem right here with it, aren't we?
Oh, yes.
How's our data, our numbers?
Oh, yes. Well, right now, about 44, you're looking at maybe 44 babies every month are dying for infant mortality in Indiana. So that's horrible. In 2019 alone, we're looking at 527 babies that died. So you're looking at capacity is for people to just really understand the depth of what that means. You're looking at like maybe 14 to 15 buses at full capacity of infants that are dying in Indiana. So people just have to really realize, like you say infant mortality, but sometimes you have to visually put a picture on top of what you're saying just to make people understand the magnitude of it. So when we say infant mortality and we're looking at the problem, we're looking at babies that are dying. So you're talking about every 14 hours, on average, a baby is dying in Indiana, and that's just ludicrous.
Wow. And when you talk about 44 babies dying each month, which is a significant number,
Significant.
what community is this happening most in?
Marion County. When you look at Marion County, out of the highest infant mortality rates in Indiana, Marion County has 4 of the highest rated zip codes with the highest infant mortality rates. So the Indianapolis Healthy Start, we are a maternal and child health program that is based within Marion County Public Health Department. So our foundation alone and our community partnerships kind of span wide, seeing that we have those resources, we have those evidence-based protocols and things that we can kind of focus on. But we look at just Marion County alone, 4 of those zip codes the highest. We're battling
Keep
those
you
infant
busy,
mortality.
apparently.
Oh yes, we are very, very busy. Yes, sir.
So certainly we don't have enough time to tell people how to prevent infant mortality, and take a long time to tell. But in about 2 minutes, what would you say to our listening audience, folks who are about to have babies or who plan to have babies?
Yeah.
How do they get a healthy start?
Well, from a healthy start, one, you have to make sure that you're focusing on those practices to make sure that we're decreasing those infant mortality rates. So looking at safe sleep practices, making sure babies are sleeping alone on their back and in a crib, because 1 in 5 of those infant deaths are safe sleep related. Making sure they're refraining from substance abuse, so decreasing that smoking and that drinking, especially when pregnant, having that father involvement, especially. Dads need to understand, too, how important it is for moms to breastfeed, and dads need to understand postpartum depression and things like that. And just for people to be socially conscious just of the racial inequities that we're facing in our communities, because it's not an equal problem, and people need to understand that it's not just, just infant mortality. Black babies are dying at a higher rate than white babies. So it's not like it's an equal situation. So people need to socially be conscious of the racial inequities in their community. If they're not getting that quality care, if they're not getting, access, to those foods and food deserts and things like that that they may sit in. So just being educated and just conscious of their environment to make sure that their babies are having a healthy start.
Ms. Ballard, you said something that was very profound. You mentioned food deserts. So when you mention food deserts, you're trying to tell us that nutrition plays a great role in this.
Yes, sir. Nutrition plays a very, very great role. You have a lot of our families who are sitting in food deserts, and when we say food deserts, that means families that do not have access to quality foods. Think about water, things like that. A lot of communities, some people leave every day. You have a Kroger, you have a Meijer, you have a Walmart that may be right around the corner. You have to think about the families who do not have those grocery stores and the access to those fresh foods and vegetables in their community, where they don't have transportation. So you have to keep in mind the families who may have to take a bus blocks with an infant to get fresh fruits and apples and vegetables and things like that. So with them sitting in a food desert, that's very detrimental as well, just for them not being able to get those nutrients they need, especially during that prenatal phase, all the stuff that baby needs, and postpartum too, with a lot of our families.
Wow. And you talked about the importance of having fathers involved, and people understanding that it's all the way through the pregnancy. And years ago, I did a study on in utero learning, and that babies can learn before they're ever born. Can you speak to that?
Well, listening to that music, a lot of people, and that's old school. You went back, but it's even more prevalent now. But even pregnant, when they say that babies learn, in utero, just listening to the voice, just knowing that mom's voice, knowing that dad's voice, hearing those sounds, playing that music,
Explicit
things like that.
hip hop and stuff like that.
Not hip hop, maybe a little jazz to soothe it, soothe the baby
No, I
down.
was just saying that's something that, that they
sounds
want
that-
to keep away from the baby.
Oh yeah, we're not gonna blast too much hip hop, while the baby's in utero. But definitely, it's been a lot of just scientific studies that talk about just music, especially in utero, and even just reading, just reading to your baby, with that baby being able to just hear those sounds and stuff and those words, in utero. So yeah.
Yeah, a lot of people don't really believe that, but it's true.
Oh yeah, it's true.
You're the
It's
expert.
It's
I'm
definitely
just
true.
talking. So, well, we got to take a break, and when we come back, we're going to have more from our Marion County Health Department and the Indianapolis Healthy Start. And Ms. Ballard is going to lead the way. We'll be back after this. Welcome back, and again we're joined by Ms. Victoria Ballard from the Marion County Public Health Department, Indianapolis Healthy Start, and you are the Community Engagement Coordinator. Talk to us about how you all are engaging the community.
Well, one of the things that we do, being in the community, is we make sure that we help families understand, not only issues about infant mortality, but also make sure that we're connecting them with community resources. So engaging the community, you have to help them understand what resources are available, where those resources are, and just be available just to answer any of those questions that they have, whether it's in relation to, maternal and child health, whether it's in relation to education and things like that. So anything that we can connect those dots to for those families are ways that we engage the community in the population that we serve.
Is that difficult to get people to access the services that are available?
It's difficult. Sometimes we do have those families that slip through the cracks. I always say we can have a mom and she can be 9 months pregnant, getting ready to deliver. And I can ask her and say, hey, were you, did you hear about Healthy Start? Or, have you utilized any of the services through the Marion County Public Health Department? And they'll be like, what? Like what's that? And it just amazes me sometimes how people just don't know any information.
About prenatal care.
About prenatal care, a lot of programs, things like that. So yeah, so just making sure, that we're getting the information out there, where there's flyers, having being at health fairs and different things like that. Different opportunities to partner with a lot of community organizations, whether it's midwives or doing things with covering kids and families and things like that. Through our Eskenazi FQACs, being at those locations as well. So any partnerships we can develop just to make sure we're engaging.
Outstanding. One of the things that we want to talk to you about is the obstacles that you all face with teaching safe sleep and convincing parents who smoke not to smoke, at least during pregnancy. And I'm wondering if you have people who are addicted to nicotine, that would be very, very difficult. Do you all teach some alternatives to that, or do you have mothers just need to stop cold turkey?
Oh, we do. Actually, through Indianapolis Healthy Start and in partnership with the Indiana Department of Health, we have a baby and me tobacco-free program, which we focus on enrolling mothers and fathers into the program. And what we do is we help them, through that journey to quit smoking. So when they identify that they're pregnant, they do smoke, we do one-on-one sessions with them with a qualified health educator who has completed the curriculum for the Baby Me Tobacco-Free program. We take them through prenatal. We give them incentives, so if they decide, and are successful with their journey to quit smoking, we offer a $25 voucher for them to get diapers and wipes for their baby if they decide to quit smoking. And when they deliver, we make sure postpartum that we follow them for a year after they deliver, because it's easy to be pregnant and say, oh, I'm not going to smoke because the baby's in. You get your incentive, and it's easy. But once they deliver, a lot of parents think, okay, well, now I'm going to start back smoking because I'm not pregnant anymore. But no, there's still an issue. It's still a significant risk for the baby. So for that year after, we make sure that we focus on that family as well to make sure they continue to not smoke. So they still get that $25 voucher every month for a year after the baby delivers. So kind of that incentive to, help them with that journey.
You also mentioned drinking and drug addiction. I don't know if you mentioned drug addiction. Is that an issue in infant mortality?
Oh, yes, it is. We have a lot of families. Well, I'm not going to say a lot, but there's a large percentage of moms that we do work with. When you look at opioid, usage and things like that, they have to go through services that are in addition to the services that Healthy Start provides, because we don't focus on that particular service. So like I said, through a lot of the partnerships in the community, we have to make sure that we are able to connect them with those services to help them through that. So it is a major problem with that drug addiction as well.
Mm-hmm. So walk us through, Ms. Ballard, because when we were growing up, you put all the stuffed animals in the crib, you put the blankets in there, you want to make sure a baby is comfortable.
Oh, no.
So what's that crib environment supposed to look like?
So right now, and you are correct about that, I always tell people, if I show a picture of my daughter's crib when she was a baby, you had the baby, the bedding bumpers around the crib, you had the toys hanging, you had the stuffed animals field all in the crib, and she was laying right in the middle. And see, that goes back to just that education, because even back then, the mindset I was in, being able to have the resources and the education, I didn't have that opportunity. So even now, nothing in the crib. No bumpers, no stuffed animals, no bedding, nothing fluffy. That baby should be alone on their back in that crib.
Not on the stomach.
Not on the stomach,
that's
on their
kind of
back.
No.
Right.
Sounds like we've done it for years.
So we're talking about the ABCs of
You
safe
did it that
sleep.
way too, didn't you?
I did it that way too. Yes, I did. But even with the research now and just studies, when you look at the Indiana Department of Health and the fetal infant mortality review boards and things like that, there has just been so much research just in reference to the safety of infants and that sleeping on the back. When you look at, how babies breathe, their esophagus, their neck, their muscles, things like that, just that safety of them being on the back and just making sure none of those choking hazards or anything that can cause suffocation and things like that are in the crib with that infant when they're sleeping.
And what would you say to parents who have their babies in bed with them?
Oh, put that baby in a bed, in a pack and play. We have a safe sleep class where we provide free pack and plays for families.
I'm familiar with that program.
If they are familiar with taking a safe sleep class, we make sure we're instilling those safe sleep practices. We're talking about that safe sleep education, and we're just making sure that when they leave, that they not only have that education and they understand it, because we do have homes that we follow up with, because through Indianapolis Healthy Start, we do have case management and community health worker services that follow up with families. So we were going into homes as well post-pandemic. We're hoping to get back to that. But there were a lot of times where you can go into those homes and they would have shoes and clothing and jackets thrown in those pack and plays. That's for the baby. That's not for your items. So it's just continuing to follow up and just instill that education about the prominence of that pack and play, but we do give them away free with our safe sleep classes.
Yeah, I've had a couple of opportunities to have you guys come in, and I think we serviced through pack and play at least 15 women at one time.
Oh, good. Good.
And we just opened it up to the west side of Indianapolis, and good showing. But the bad part about it is young mothers are just not interested in that type of information.
It's hard.
Yeah.
It's hard.
Yeah, I've done, a couple of years ago, I officiated a funeral with a baby that the parent rolled over on, just didn't know it. It was a challenging funeral. And as you indicated, it happens more often than what people really realize.
Yeah, it definitely happens more often than what people realize. And when you talk about it, which was what we try to do through Indianapolis Healthy Start, we try to make sure that we're bringing awareness to infant mortality. Like September is Infant Mortality Awareness Month, but not only highlighting a lot of the issues that are occurring during that month, but just annually, just throughout the year, just keeping those messages prominent, just making sure that information is blasted throughout the community, making sure our partners are sharing that information, you know, when families are going to the doctor and things like that. So yeah, so just the thought of seeing an infant casket, that alone should kind of trigger in people's hearts and their minds just to pay more attention, you know, just to the prominence of infant mortality and what's going on in Marion County.
We got about 30 seconds left. What's the most significant thing you would share with our viewing audience?
Just to make sure everybody is just paying attention to the safety of their infants. You know, if you need more information, just to make sure you contact Indianapolis Healthy Start. They can call me at 317-221-2126, or they can email me at vballard@marionhealth.org. And just making sure we're just keeping infant mortality just #1 issue and just prominent on everybody's radar in Marion County.
Well, you've been a great guest.
You have.
Thank you for your service.
No problem. Thank you.
Stay with us. We'll be back after these messages. Welcome back to Real People, Real Voices. I'm James Jackson.
And I'm Pastor Wayne Moore.
I'm Curtis Baker, your producer of Real People, Real Voices. These fine gentlemen right here are so great at this fine program. I really appreciate what you do.
Thank you.
It's a fine program for a lot of reasons, and especially because of our sponsors.
Yeah. Tamiko and Associates, Realty Group, Martin University, Marion County Public Health Department, Lee Cussell and Crawley, Al's Martin Clothing. Then we have His Place, North Side Window and Gutter Cleaning. And then we save the best for last, Fervent Care Christian Academy, right here, sponsors for Real People, Real Voices.
We're very grateful to God for all of the sponsors that we have. The Marion County Health Department was here.
Yes, and you know what I was gathering from this interview with Miss Ballard about having the babies in the crib. And we all grew up with teddy bears and blankets and toys and all sorts of things inside of the crib, and that's wrong. We just discovered. I'm just trying to find out, when did we find out that was not a good thing to do?
Yeah. You know, the data, I suppose, is accumulated over the years. But miraculously, most of us made it through.
Yeah.
Thank God for that.
Yeah, it was none but the grace of God that brought us through.
Right.
But now the knowledge is so prevalent and it's out there. I urge and employ young ladies and young men and young couples to get prenatal care.
Yeah.
I urge it. I think it sounds like it's, well, I know it's important. My last grandson, Crescent, he was a prenatal all the way. And so that's what it's all about.
Yeah, so we're praying for you, and if you're smoking, stop so that baby can be healthy. And they got some resources at the Marion County Health Department to help you through that. Thanks for joining us. We appreciate you, and we'll see you next time.